important topic, which is the superficial pulmonar arch. Under this short note, we will be discussing about its introduction, branches, relation and its surface anatomy. I will be explaining in detail about superficial palmar arterial arc. It is the direct continuation of the ulnar artery beyond the flexor retinaculum. The arc is completely lateral by anastomosing with one of the following branches of the radial artery, which are superficial palmar branch of the radial artery, principal artery and the radialis indicis artery. Let us move on to its branches. There are three main important branches to be remembered, which are three common palmar digital arteries which go to the interosseous clefts between the fingers and each divide into two proper digital arteries. In the interdigital clefts, they are joined by the palmar metacarpal arteries. The second one is the one proper digital artery which runs along the medial side of the little finger, and the third one is the cutaneous branch to the palm. Let us discuss the most important points to be remembered under superficial palmar arc. It is completely lateral by anastomosing with following branches of the radial artery, which are superficial palmar branch of the radial artery, radialis indicis artery and the princeps pollicis artery. Let us move on to its branches. There are three common palmar digital arteries which go to the interdigital clefts between the fingers and each divides into two proper digital arteries. The next one is the one proper digital artery which runs along the medial side of the little finger and which it supplies. The last one is the cutaneous branch of the palm which supply the skin and the superficial fascia of the palm. Let us move on to its relations. Superficially is related to the palmar aponeurosis and its deep relations are long flexor tendons of the flexor digitorum superficialis and the flexor digitorum pollicis. And next one is the lumbricals and the digital branches of the median and the ulnar nerves. Let us move on to its surface anatomy. The superficial palmar arc lies across the center of the palm at the center of the distal border of the fully extended thumb. Let us move on to the next important short note, which is the deep palmar arc. The topics will be covered under this short note is its introduction, branches, relation and its surface anatomy. Now I will be explaining deep palmar arc in detail. Deep palmar arc is a direct continuation of the radial artery and the arc is completely medial by anastomosing with the deep palmar branch of the ulnar artery. Let us move on to its branches. There are three main important branches which are three palmar metacarpal arteries, three perforating arteries and the recurrent branch. Let us summarize the most important points to be remembered on a deep palmar arc. The deep palmar arc is a direct continuation of the radial artery and is completely medial by anastomosing with the deep palmar arc of the ulnar artery. And the radial artery gives off two branches which are arteria radialis indicis and arteria princeps pollicis. Let us move on to its branches. Under branches, there are three important points to be remembered, which are three palmar metacarpal arteries, three perforating arteries and recurrent branch. Under relation, there are two parts, which is the deep relation and the superficial relation. Proximal parts of the shaft of the metacarpal and the interosseous muscles are the deep relation. Long flexor tendon of the fingers and the lumbricals are its superficial relation. Let us move on to the next important short note, which is the posterior interosseous nerve. Now let us discuss in detail about the posterior interosseous nerve. To give a very brief introduction, it is a deep terminal branch of the radial nerve and arises in the front of the lateral epicondyle. It bears a pseudoganglion. Let us move on to its course and relation. The nerve appears in the back of the forearm by piercing the supinata muscle and winds around the lateral side of the radius. To move on to its branches, before piercing the supinata, it is the extensor carpi radialis brevis and the supinata. After piercing the supinata, the following branches are given, which is divided into muscular branch, articular branch and the sensory branches. Under muscular branch, the short branches to the extensor digitorum, extensor digiti minimi and the extensor carpi ulnaris. The long branches are divided into medial set, which supplies the extensor pollicis longus and the extensor indicis. The lateral set, which supplies the abductor pollicis longus and the extensor pollicis brevis. The articular branches to the wrist joint, inferior radioulnar joint and the intercarpal joint. The sensory branches are to the interosseous membrane, radius and the ulnar. Let us discuss in detail about the important points to be remembered under posterior interosseous nerve, which we have discussed in detail in a form of a diagram. Let us start with its introduction. It is a deep terminal branch of radial nerve and arises in the front of the lateral epicondyle, and its peculiarity is that it possesses a pseudoganglion. To move on with its course and relation, the nerve appears in the back of the forearm by piercing the supinata muscle and winds round the lateral side of the radius. Let us move on to the branches. The two branches are the branches that are given before piercing supinata, which are extensor carpi radialis brevis and the supinata. After piercing supinata, under the muscular branches there are short branches and the lateral branches. Under short branches, it is to the extensor digitorum, extensor digiti minimi and the extensor carpi ulnaris. The long branches are divided into medial set, which supplies the extensor pollicis longus and the extensor indicis. The lateral set, which supplies the abductor pollicis longus and the extensor pollicis brevis. Articular branches to wrist joint, inferior radioulnar joint and the intercarpal joint. The sensory branches to interosseous membrane, radius and the ulnar. Let us move on to its clinical correlation. The posterior interosseous nerve may be damaged during the surgical exposure of the head of the radius and the fracture proximal end of the radius. Let us move on to the next important topic, which is the anatomical snuff box. Let us discuss about the boundaries and the contents of the anatomical snuff box. Anterior laterally, it is a tendon of the abductor pollicis longus and the tendon of the extensor pollicis brevis. Posterior medially, it is a tendon of extensor pollicis longus. And the floor, it is formed by the scaphoid and the trapezium, and the roof, it is formed by the skin and the superficial fascia. Radial artery is the contents of the anatomical snuff box. Let us move on to the structures crossing the roof of the anatomical snuff box. The cephalic vein from the medial to the lateral side and the terminal branches of the superficial radial nerve from the lateral to the medial side. Let us summarize the most important points to be remembered under this short note. It is an elongated triangular depression seen on the lateral side of the dorsum of the hand when the thumb is hyperextended. Let us move on to its boundaries. Anterior laterally, it is the tendon of the abductor pollicis longus, tendon of extensor pollicis brevis. Posterior medially, it is a tendon of extensor pollicis longus, and on the floor, it is formed by the scaphoid and the trapezium and the base of the first metacarpal bone. In the roof, it is formed by the skin and the superficial fascia. The contents is the radial artery. Cephalic vein from the medial to the lateral side, terminal branches of the superficial radial nerve from the lateral to the medial side of the structures crossing the roof deep to the skin. Let us move on to its applied anatomy. The pulsations of the radial artery can be felt in the anatomical box. The tenderness in the anatomical box indicates fracture of the scaphoid bone. The cephalic vein at this site is often used for giving intravenous fluids. The superficial branches of the radial nerve can be rolled over the tendon of extensor pollicis longus. To upgrade and enrich your medicine in the fingertips and to also get updated